MTHFR stands for methylene tetrahydrofolate reductase. It's getting attention due to a genetic mutation that can lead to high levels of homocysteine in the blood and low levels of folate and other vitamins. There's been concern that certain health issues are associated with MTHFR mutations, so testing has become more mainstream over the years. Gene mutations are inherited. This means that you can acquire them from your parents. At conception, you receive one copy of the MTHFR gene from each parent. If you have both mutations, your risk of having a homozygous mutation is much higher. Varying from person to person and from variant to variant, if you do a quick search, you'll likely find many websites claiming the MTHFR directly causes a number of conditions. Keep in mind that research on the MTHFR and its effects are still evolving. Evidence linking most of these health conditions to the MTHFR is currently lacking, or it's been disproven. More than likely, unless you have problems or you've got testing done, you'll never be aware that you have an MTHFR mutation. Conditions that have been proposed to be associated with the MTHFR polymorphism include cardiovascular and thromboembolic diseases, like blood clots, stroke, embolism, and heart attacks. Depression, anxiety, bipolar disorder, schizophrenia. Colon cancer, acute leukemia, chronic pain and fatigue, nerve pain, migraines, recurrent miscarriages in women of childbearing age, pregnancy with neural tube defects, like spina bifida and anencephaly. The risk is probably increased if a person has two gene variants or is homozygous for the MTHFR mutation. Some at-home genetic testing kits offer screening for the MTHFR. Some of these are the 23andMe and the MyHome MTHFR. Having an MTHFR variant doesn't mean that you need medical treatment. It could just mean that you need to take a vitamin B supplement. Treatment is typically required when you have very high homocysteine levels, almost always above the level that's attributed to most MTHFR variants. Your doctor can rule out other possible causes of increased homocysteine. Other causes could include hypothyroidism, conditions like diabetes, high cholesterol and high blood pressure, obesity and inactivity, and certain medications. You could check out my other videos for information on natural treatments of the conditions like diabetes, high cholesterol, high blood pressure and weight loss. The MTHFR gene mutation inhibits the way that the body processes folic acid and other B vitamins. Changing the supplementation of this nutrient is a potential focus in countering its effects. Folic acid is actually a man-made version of folate, a naturally occurring nutrient found in foods. Taking a bioavailable form of folate, a methylated folate, can help your body to absorb it more readily. Most people are encouraged to take a multivitamin that contains at least 0.4 milligrams of folic acid per day. Pregnant women are not encouraged to switch prenatal vitamins or care based on the MTHFR status alone. This means for them taking a standard dose of 0.6 milligrams of folic acid per day. In simple terms, it's a biological process involving a group of metal molecules, and it's essential for your body to function normally. For example, every cell needs adequate methylation for its normal growth and repair. Methylation helps the body to detoxify and eliminate potentially dangerous substances. Proper methylation is particularly important for the brain and the neurotransmitters that influence your mood. When these metal molecules are in short supply, it results in undermethylation, and it can have a number of effects. Many undermethylators display a type A personality trait. They're highly motivated, competitive, perfectionist, high achieving, and frequently have successful careers. They appear to be in good health. On the other hand, undermethylation can also be associated with higher inner tension, depression, and obsessive-compulsive tendencies. Undermethylation reduces the production of serotonin and dopamine. These are two powerful brain chemicals called neurotransmitters. They help to send messages between the nerve cells in the brain and the rest of the body to regulate your actions, thoughts, and moods. Serotonin is often called the happy neurotransmitter. It has a calming effect, and when undermethylation causes the levels to drop, it can result in anxiety and depression. Dopamine is the neurotransmitter that motivates and stimulates actions, and this leads to feeling of reward and satisfaction. Undermethylators are often involved in activities that naturally raise the dopamine levels. They eventually experience exhaustion and burnout, and they often turn to substance abuse or become addicted, perhaps to alcohol or coffee, as an alternative way to achieve a reward sensation. Undermethylation interferes with the production of glutathione. The liver needs this protein compound to carry out its major role in removing toxins from the body. Glutathione is also important as an antioxidant to prevent cell damage. Undermethylation affects the body's access to methyl B12. This is a form of vitamin B12. A deficiency of this can lead to low energy, poor concentration, sluggish thinking, and anemia. Undermethylation is also associated with a range of physiological and psychiatric disorders like migraines, allergies, sleep disruption, mood regulation, memory problems, depression, and schizoaffective or bipolar disorder. Hormonal imbalances like polycystic ovary syndrome, PMS, fibroids, endometriosis, etc. Methylation is important for metabolizing and detoxifying estrogen, and so, if it's a little slow, it can lead to many of the symptoms above. Also, if periods are excessively heavy, you might need more iron, folate, and B12 to build new blood. Infertility, both male and female. A history of miscarriage or pregnancy-related complications like pre-eclampsia. Methylation is absolutely crucial to the growth of new tissue, so it's vital for fertility, maintaining a healthy pregnancy, and supporting fetal growth. Your need for nutrients, like folic acid from folate in particular, increases exponentially during pregnancy. In addition, if you've experienced any of the problems above, your requirements may be higher in comparison to a person who hasn't. Therefore, diet alone may not be enough. Cardiovascular disease, high blood pressure, and poor circulation. If you're not methylating properly, you can end up with high levels of homocysteine. Excessive homocysteine can lead to inflammation and free radical damage, especially in your blood vessels. Memory problems, insomnia, dementia, and Alzheimer's disease. Just like high homocysteine can be damaging to your blood vessels, it can have the same effect in the brain by damaging the neurons and causing inflammation. Multiple studies have linked poor methylation to cognitive problems. In order to sleep, we need to produce the sleep hormone melatonin from serotonin, and this process also happens through methylation. Chronic fatigue, ME, and low energy. Energy production, healthy thyroid, adrenal, and nervous function are all dependent on methylation and a good supply of vitamin B12, B6, folate, zinc, and magnesium, all of which get the methylation cycle going. Allergies and histamine intolerance. Eczema, hay fever, headaches, congestion, hives, etc. Allergies are characterized by an increased production of histamine, a chemical that causes all of the symptoms that we associate with allergies, sneezing, itchy, runny nose, and watery eyes. Excess histamine in the cells is cleared by adding a methyl group to it. This makes it inactive and ready to be excreted. Poor bile production leading to digestive problems, fat malabsorption, and gallbladder issues like gallstones. Bile is a thick yellow-green fluid produced by the liver, and it's stored in the gallbladder. It plays a few vital roles. When secreted into the intestines, it has antimicrobial properties, cleansing the bowel and preventing the overgrowth of unwelcome bacteria and yeast. It also aids the absorption of fat and fat-soluble nutrients like vitamin A, D, E, and K, and it helps your body to excrete toxins and excess cholesterol. You can see how vital it is for your overall health. However, if your methylation is disrupted, you might not produce enough phosphatidylcholine, a key component of the bile. Inflammatory conditions like arthritis and inflammatory bowel disease. Constant inflammation is a big strain on the body in general, and it can drain your methyl pool, the availability of methylated molecules in the body that are ready to be donated to various essential processes. If this pool is continuously drained by inflammation, other essential processes like tissue repair or neurotransmitter production can be affected. If you have chronic digestive disorder like irritable bowel disease or pernicious anemia, your absorption of vital nutrients like vitamin B12 may also be significantly reduced. Important methylation support can include taking riboflavin, vitamin B6, methylfolate, vitamin B12 in the form of methylcobalamin, choline, betaine or trimethylglycine, magnesium and zinc. So basically taking a high quality multivitamin and also a multi-B vitamin, and then taking a methylfolate and a B12 as methylcobalamin, all to increase the demand for these vitamins. And then sulfurous compounds like trimethylglycine, DL-methionine and MSM, which can all act as metal donors, along with magnesium bisglycinate and zinc for their effect of acting hundreds of the body's enzyme systems. Unfortunately, when people start taking methylation support, many discover the majority of the supplements on the market are either far too potent or far too weak. Too much methylation supplements can cause headaches, irritability, insomnia, runny nose, body pains, and itchy skin. While having a potent methylation support supplement is great for some, it isn't the right fit for everyone. As B vitamins are water soluble, you'll naturally detoxify any excess daily. Therefore, there should be no reason to fear experimenting with different doses of B vitamins to help to determine what works best for you. Some of the symptoms and the traits of undermethylation. You can have chronic depression, a history of perfectionism, seasonal allergies, history of oppositional defiance, high libido, adverse reaction to benzodiazepines and folic acid, a good response to SSRIs and antihistamines, sparse body hair, suicidal tendencies, addictiveness, phobias, denial of illness, obsessive-compulsive tendencies, ritualistic behaviors, be strong-willed, self-motivated during school years, have a history of competitiveness in sport, calm demeanor but high inner tension, family history of high accomplishment, frequent headaches, slenderness, dietary inflexibility, and terse speech. Some of the symptoms of over-methylation: high anxiety, panic, hyperactivity, rapid speech, loss of libido, religiosity, tendency to be overweight, nervous legs, pacing, adverse reactions to SSRIs and SAMe, improvement with benzodiazepines, dry eyes and dry mouth, low motivation during school years, depression, self-mutilation, sleep disorder, tinnitus, food and chemical sensitivities, artistic or musical ability, copper overload, estrogen and antihistamine intolerance, and absence of seasonal allergies. Overmethylation treatment. The treatment program consists of the administration of high doses of zinc, manganese, vitamin C, niacinamide, vitamin B12 and folic acid. With this treatment, the high blood copper is slowly reduced, and the symptoms are slowly relieved within several months. Response to treatment is usually good, but it can be slow in patients who've been ill for a while. Some individuals initially experience a worsening of symptoms due to the recirculation of the body stores of copper. Overmethylators tend to do poorly on supplements like SAMe, inositol, tryptophan, phenylalanine, trimethylglycine and dimethylglycine, so these supplements should be avoided. For more information about herbs, supplements and natural treatments, check out my website.